What's up, everybody? This is Eugene. Eugene Does Hair with my co-host, Angela, founder, creator of Lady St. Lucia Lashes, and of course, the wonderful Dr. Assif, who we are now on our third episode going over this time mechanical treatments for acne. What does that even mean, doctor? Talk to us.
Well, yeah, mechanical treatment. We talk the first episode. We talk about acne. What is acne? Topical. The second one, the episode number 2, we talk about the oral antibiotics and all oral medication for acne. And right now we're gonna talk about a mechanical. So what do you use? You use topical, use oral, something you're gonna use mechanical. That means it's like not topical, not oral, but outside. So peels, lasers, all that stuff. It's like mechanical treatment. And that's part of the treatment basically. Like I said before, acne is not like just one treatment. You start with topical. If topical doesn't work, and oral. Sometimes you combine this mechanical treatment, which is kind of really very good help for the whole picture of the acne. Because it's like the acne treatment is not just one thing. Maybe one, maybe mild, maybe a little bit of difficult. It just you need to combine all these treatment to get the best results. So for mechanical treatment, let's start with the mechanical, which is chemical peel.
Okay.
In our office, be honest with you, we use a lot of chemical pills. One of the chemical pills we use is the VI pill, but there is not just VI pill. There's other mechanical pills. And basically, mechanical pills, what it does, it just take all this, the out layer skin. The out layer skin is just spit it out. And like we talked before, this is the ingredient of this pill, the acne pill. We call VI pill, and basically there is different pills, and kind of pills are basically it just made for acne, because you can go like Angela will come, it's like, oh, I want a pill. I don't have to give her acne pill. I can just give her regular acne to just peel out her skin. As everybody knows, our epidermis multiply. There is a dead skin. Anyway, everybody has to have exfoliation at least twice a year. It doesn't have to have an acne or like anything else. It just regular have to exfoliate. As you know, like exfoliation is a big part of skin treatment. Like we do the same thing we do like sunscreen, we do moisturizers. Exfoliation is a really big part of our skin. Okay, so somebody who has acne, exfoliation is more important than regular. Why? Because as we talk earlier in our episodes, if somebody didn't see the other one, I urge you to go and see, because it's good. It builds so you're understanding, so you can come up and understand what we're talking about. So like we talked before, acne really, if you don't open up your pores, acne love it. Why? Because those bacteria that cause acne, they love situation where your pores are closed. Basically, there is no oxygen. This bacteria survive. They love when your skin is closed or there's blockage. So when you clear up that dead skin, is really help your skin, get rid of the acne. And like we talked before, the VIP, the chemical treatment, look what it has. It has, TCA, which is acids, glycolic acids, which is we talked a long time ago, like the other episodes. Acids is good for the acne, because what happened, it is the sebum production or the oil production. So whenever you have less oil production, less acne. Look, retinoic acid, remember, we say before, exfoliate is a huge part of your acne. Retinoic acid, you remember, it does exfoliate your skin. Salicylic acids, like anything acid, inflammation, it's good to decrease. Vitamin C, remember, it's good for your skin. It's like also
Oh,
it kills all the bacteria. decrease hyperpigmentation, decrease your sebum production. Hydrocortisone, decrease your inflammation. As you see, all what you see in here are good for bacteria, are good for your sebum production or oil production, good for your inflammation. When it decreases your hyperpigmentation, and it's a beautiful. I guess it's not expensive treatment.
It's
Most
not?
of the places you can do it. Yeah, it's mostly between 200 and $300. So
Okay.
basically, and you can, yeah, and it's amazing product for acne. Actually, in fact, is one of my favorite things to do beside the treatment. This acne treatments. It's amazing.
Now,
Any questions?
how long does it take to do a pill?
Actually, the pill it takes about 10 minutes, 5 minutes.
And how many sessions do you have to do?
Actually, for pills, like once every 3 months for acne.
Okay.
So
Oh, wow.
yeah, one every 3 months, but the peeling may take for 4 days or 5 days. Okay, the treatment itself about 5 minutes, but the peeling you can be peeling for 5 days. So, but be honest with you, I do it for myself. It's just the only thing. Of course, when you're peeling, you cannot expose yourself to the sun, okay? Because when you're peeling, your all that dead skin is out, so that baby skin is still on the bottom. You don't want to get exposed to the sun for inflammations and for burn. Okay,
Okay.
Angela, any questions for the pill?
Yeah, so you said the peeling, you see it in about 4 or 5 days start peeling. What is the overall recovery time? So once you get your first session for the peel, you experience the peeling. Now your skin is obviously, after all the peeling, it's kind of vulnerable. So what is the time span between the treatment and the healing process? Like, how long does that usually take?
Yeah, well, it's usually about between 5 days to 7 days, 7 days max. Then you are normal. Yeah, about but I would say about 5 days downtime. Doesn't mean that you can go to work. You can do whatever you want to do. Actually, it's not. It's how you're comfortable to feel like you're peeling in front of everybody else. And be
Right.
honest with you, it's becoming so popular. Then right now, when you are peeling, there's just people know that you did chemical peel. So people becoming very really they know, oh, you're doing peel. So it's not like something crazy you are doing right now. Everybody knows about it.
So when you are in the healing process, is there something that they're supposed to apply to their face during this time, or do you just kind of wash it and leave?
Yes,
Or
that's a very good question. So during the process, actually, you're gonna get with the peel, you're gonna get sunscreen with it, and you get like some stuff to use every day with it as you go by for the first 3 or 4 days.
okay,
So actually, when we give you this VIP, we give you also a package with it. It comes with sunscreen. It comes with something acid you do at night. It comes with like also like cleanser. It comes with everything with it for the
okay,
first 5 or 7 days.
okay,
Oh, wow. That's a deal. That's amazing.
It comes with everything. It comes with like basically sunscreen, cleanser, and some anti-inflammatory, so it doesn't burn much. It's like steroids a little bit to put it in your face, so the inflammation is not that much. So it comes with the whole package for 5 days till you heal.
okay. That's good to know, because I know there's I hate to say it, there's a lot of companies out there that say that they do these kind of treatments, but they're not really qualified to do it. And so then people end up getting damages and skins, and next thing you know, they're just putting on random stuff on their face because it was like a chemical peel gone wrong. So in my opinion, I think this is definitely ideal to come to a professional like you. But what would you say to somebody who accidentally did like maybe a at-home peel, or they try to do it
Oh, yeah.
themselves?
So yeah, that's Angela, you have great questions. I love that. As a doctor, I just need those questions because I can't be talking the whole,
Yeah.
can't be talking the whole. But it's amazing how your question is so important, because for me as a doctor, you know, I may talk medical point, but people also has to kind of these questions. Sometimes I forgot about them, which is great. So yes, very important that it's not to do those peel by yourself because you can burn yourself. Because those acids are not the way how you rub your skin. Because if you rub too much your skin with this acid, it may cause burn. This chemical pill. This is not like a pill that are done by yourself. This is not like a regular, because there is some chemical, there is some pills, but some pills are very light, you know. But those chemical pills, it needs to be done by a professional. Because be honest with you, if you take that one, just you do like 3 passes, like 4 passes, you may end up by getting a burn in your face. So
Wow.
so
Okay.
please do not buy this and use it for yourself. It's not like I say, it's not gonna cost you much, about between $200 and $300. Even if you wanna buy it, it's not gonna save a lot of money if you wanna go and done by a professional. It hasn't to be done by a doctor like me, but as long as esthetician, professional esthetician, or something like be doing this for a long time, it's okay. But it cannot. But these chemical pills, be honest with you, it should be done in a doctor environment.
Okay.
Like, you know, kind of a little bit of, because the one thing is, you like I say all the time, lasers, chemical pills, everything, it's on the hands of. It's not the products they're gonna do the whole job for you.
Mhm.
Like I
It's
told
the
everybody,
application.
yeah, it has the best laser, like the most expensive machine, and you can burn somebody else with laser. You may have the best product, like chemical pills, and you can burn somebody. It's also who is doing it for you is the most important.
Yeah.
Just if you do it, don't just say, okay, well, my friend did chemical pill, I'm gonna do it. You're gonna choose the right person to do these things for you.
Someone
And
call.
I'm not just about chemical pill, but also lasers, everything.
Right.
Lasers, I saw a lot of burns. I saw like the pen, because lasers, you have the laser. It's like, how you want to say it? You can, anything in life, you know, it doesn't mean if you have that products, it depends who's doing it. That's the more, is this the skills, the, you know, and the experience that is really very important when it comes to these things.
Right. Okay. So in the alternative, like of any other options besides chemical peel, is the chemical
That's right.
peel, is the chemical peel your most preferred method, or do you have another method that that you like just as much or even better?
That's right. Usually I do chemical pills are amazing. Sometimes what we do, and you asked me about that last time. So we do sometimes some light. You know, remember you asked me, Angela, about the
Yeah,
red.
the red light therapy. Uh-huh.
Yeah, the light therapy, the wave light therapy. You know, there is 2 kind of light therapy we use. We use the blue and use the red. If you
Okay.
see the blue in here, do you see it, or I increase
Yeah,
the?
yeah, we see it.
You could see the blue light. It's like about 400 nanometers, nm nanometer. The red one is deeper. The 400, the blue is 400. It's very superficial.
Mhm.
It's like you see in here. The blue one. What is the blue one? It's 450 to 495 nanometer. The red is between 60 to 70. So the red, it goes deeper.
Okay.
The blue light is more superficial. And
Okay.
usually people, they ask me, what is the difference between the red? It's just our cells absorptions. It goes to 400 because, you know, our cells in our skin, there's some absorption. The blue will go only superficial. The red will go deeper. And that's the difference.
And what does
And
the
if you
red
ask
light
me what
therapy
it
do?
does, yeah, the blue and the red, they do the same thing. So like I say, the blue therapy is very superficial, the red go deeper. So for the blue, like for example, this is what it does. It's basically, like I say, let me go deeper. I don't want to go to, so our skin, this bacteria absorbs the blue light, about 415. When it absorbs that light, intracellular, so it starts producing oxygen. because those lights react with our cell, and there is what we call here called porphyrin, which is produce some oxygen, and this signal oxygen destroy acne. Remember what we talked before.
Uh-huh.
This bacteria acne, we call Perinobacterium acne, this love state we call anaerobic phase where there is no oxygen. This
Okay.
light, when you go to your cell, it produces some porphyrin, which is produce oxygen and kills the bacteria. So in a way, this blue light will kill bacteria.
Okay.
Why? Because this blue light will form oxygen in your cells, and those oxygens kills bacteria. Did I explain myself? What do you think?
Yeah.
Yeah, no, that's great. Yes.
So in a way, you put somebody in blue light, and this blue light go to your cells. Your cells produce oxygen, and this oxygen kills the bacteria. Is that very simple?
Yes.
Is
So-
a very simple way to explain it?
Yes. Is this what you would call laser treatment as well, or is that something completely different?
This is light therapy. This is a light therapy. This is not laser. This is a light.
So laser is completely something different.
That's very different. We talk, remember, light therapy. This light therapy can be good, and also this light therapy it's also decrease the inflammation. It
Okay.
does not also kill, when it kills bacteria. Remember, bacteria cause inflammation,
Right.
and when you do this light therapy, it's really kills bacteria and kills oxygen. Remember, this is really for not severe acne. This is basically, it's for acne that it's not severe. This should not be, if you see here, should not be used for nodular acne.
Okay,
Big
so it's for mild condition.
or mild condition.
Okay.
Okay. And remember, this therapy also it's 80% can work, 20% cannot work. It does not work 100%. So 80% of people this therapy may not work for them, but 80% will talk. Like you see, this results combination with therapy can achieve 80% of clearance, by 80% of clearance. So, but the therapy doesn't work for everybody. So, you're gonna tell me what is the difference between the blue and the red therapy? The red therapy, the only difference, it goes deeper, because sometimes the inflammation is very deep. So you want to kill the inflammation on the top and the inflammation on the bottom.
Okay.
So you want to light that go superficial, the light go bottom. Let me see. So for example, let me see. You see the blue one, 400. The red one goes deeper to 600 something. It goes much deeper.
Uh-huh.
See what it is? So the blue light will kill the bacteria in the top. The red light will kill the bacteria in the bottom. And you know what we do? Let me see, go in there, up in there, up in there. Blue light. Let me go to the red light. So this is the red light. It's the same thing. It's just the red light will go deeper to 630. So it's deep penetration than the blue light.
Now, doctor, how often do people get light therapy treatments?
That's right. Very good. So the most, what we do about 8 treatments over 4 weeks. So we do about 2 treatments a week.
And how long is the treatment?
The treatment usually, like most of the time, the treatment we can do it, for 8 months, but we do about but mostly we do about like 4 weeks, then we see the results. And what we do, like for example, if you see here, for 4 weeks, so we do at least 2 treatments a week, and you have to leave at least 48 hours. So basically we do treatment every 3 days. So if we do Monday, probably we do Wednesday. If we do Tuesday, we do Thursday. You can do, and you can alternate blue and red light. For example, you do Monday, you do a blue light. Wednesday, you do red light. at least you have to be 48 hours. You can do it every 72 hours, and you can do it for 2 months.
Okay.
Yes.
And how long is the light on your face? Is that like a 10-minute? Is it a 30-minute? How long is that?
Okay. Very good question, Eugene. I was gonna be. It's about 20 minutes treatment. Okay, so you got it. I was right now for you. So it's about 20 minutes treatments. You do it about like kind of 4 weeks, and you can alternate, like say every 3 days, and really it's very, very good. Treatment package is not that, I don't know what is expensive, but you can get this package for $400 to $600 for actually 8 weeks for 2 months.
I have a question
Yes.
because, being a guy, I shave my face.
Yes.
Can you do this after somebody has shaved, or are they recommended to not shave for a couple days? What about guys as far as with facial hair?
That's a very good question. For facial, I would probably just not do it the day of when you're shaving.
Okay.
I would just probably
So-
not do it the day, but you can do it like it's not. Yeah, go ahead.
So say like I had a treatment on Monday, I would shave maybe Sunday, but not Monday morning.
Yeah.
Okay.
So you can shave just the night before. Doesn't matter.
Okay.
Just like you don't wanna shave the day, the same day. It's just because of inflammation, redness, kind of a little bit maybe too harsh for your skin. Actually, this is the expectation. So the results, optimal result is it's seen 8 to 12 weeks after the last treatment. So
Okay.
for example, the last treatment, so the result will be seen 8 to 12 weeks after the last treatment. So you don't see the result right away.
Okay.
And basically a redness, there's some redness, they may last to 1 to 3 months, just let you know. So those are the side effects, and also acne, when you do this light, initially they may somebody tell, oh, I have more acne. There may have some flare up of acne initially when you start doing this light. Maybe, oh, I have more acne. It's not a big problem. So, and this light, just let you know, is not done for severe acne. It's just done for mild acne, like I did before, for what we call comedo, like, severe cystic acne. This is not for that one. This is just for mild acne, okay?
Okay. Would this also help with dark spots, hyperpigmentation that's caused by acne? Would that help clear it up as well?
What is that, Angela? I'm sorry, I didn't hear you.
Would this be good for dark spots or the hyperpigmentation or scarring that has been left by acne? Would it help prevent?
It is good, but it has to be like I say, combination of therapy.
Okay.
Yeah, it's great. Remember, all what we're talking about, it is decrease inflammation, but all what we're talking about, most of these people, they're gonna be in kind of like topical antibiotics, topical, acids. Remember, we talk about salicylic acid or, retinoic acids, all benzoic peroxide. Remember, we talk about topic. This is kind of complementary of the treatment. You can't just be on this treatment by itself.
Okay, so it's like a combination of different procedures.
That's right. So like you say here, complementary medication, has, be honest with you, I will not start with blue and red. I would start with medication first, and we go, I'm not going to say, oh, somebody has acne. It's like, okay, you're going to do red and blue therapy. This is, for me, it's a combination of therapy.
Okay.
And like I said before, only 25% of these patients may not see the treatment with the red and blue. So in a way, also, we say earlier, patients with severe acne, they are not candidate for blue and lead. That's like a different treatment when you have severe acne.
Okay.
Those really, they have to be in like we talk about, like oral, they have to be antibiotics. They may have to be in Accutane. Remember we talk, people with severe acne, they may be in Accutane, they may be in a lot of things.
Okay.
So I was gonna do some treatment. Let me see in here.
Ooh.
What is that? Yeah, that's redness. Maybe let me just see what's so the Eugene, you talked to me about people that they're gonna try to this pill. So three key factors when they can be the pH,
Okay.
toxicity. You know, like kind of we may go up in the acids, but what is the safety? Also, it's you have to kind of we have like some of them are superficial mild, some of them are very deep peels. So also when you come in there, depend of the acne, we can go deep. More deeper you go, more exfoliation is gonna be. But when you get that peel, there's different grades. There's like superficial mild, and there is a deep grade that you can have.
So are they gonna experience any pain or discomfort getting these treatments, especially like the
That's right. You're gonna get some discomfort, but we give some steroids, kind of, so you can have less pain, less inflammation. So, like I say, with package cleanser, sunscreen, some steroids to keep that pain, in control.
Okay.
Everything will come up with the package. So, let me talk about we talk about laser treatment.
Yeah, I want to hear about laser.
Yeah, laser. Yeah, let me talk about the laser. Let me talk about that. Okay. So, let me talk about the laser. Laser probably in here not very good, but I'm gonna just talk to you. So in laser, there is especially for acne, there is different kind of laser. Depend what you can have and what kind of scarring you're gonna have from acne. So for severe scarring, we do what we call ablative laser. You know, a lot of people really are confused about with this laser. When you talk about people, what is ablative? What is not ablative? They have they don't know what ablative, what not ablative. I'm just gonna make it very simple.
Okay.
Ablative, it's anything that will get rid of all this outlier skin, or
Okay.
I'm gonna say vaporize your outlier skin. So your outlier skin is gone. It's more kind of exfoliation, but it's more than exfoliation. So basically, it's what it does. The laser go deep, vaporize your skin from the heat, and all your skin is up. So the way how the laser does it, the one ablative, they go deep to your skin. They are very deep.
Okay.
They hit the heat, and all these outlier skin vaporize, get out. So basically, you have no skin left.
Oh.
The deep fire skin. That's why the downtime for this ablative laser may be a long time. It does not, is that, look at how it does the ablative skin. There is two ablative lasers. There is the CO2 lasers, which is very deep, and there is also the erbium laser, which is go to 2940, very deep.
Mm-hmm.
And when the laser go deep, it heat up your deep layer skin. When it heat up your deep layer skin, it vaporize your outlier skin and take out all your outlier skin. It's basically, you have only like a baby skin. So what it does, it takes all those scarring, all of your skin, and that's very aggressive treatment.
Yeah, it sounds like it.
The C2 laser, the ablative laser, it was to be in the past. It takes about actually more than 1 month's downtime, about 1 month.
Wow.
Yeah. So it was very aggressive. But the good news is, which is I have in my office, we have this erbium laser. The erbium laser, it's really very aggressive, but you don't have that much downtime, the same as the C2 laser. It's very it's a good new laser. It's very deep. It's more expensive than the CO2 laser, but it's the downtime is not as bad as the CO2 laser. And the downtime about 1 week. Instead of 1 month, it's 1 week. And that I have it in my office. And also the only difference is the CO2 laser, you do it, you cannot do it, you will do it like, if you do it once, then the next treatment will be in 6 months. The erbium laser, you do it like every 1 month for 3 months. So whatever the results that you get with CO2 laser in one treatment, you need 3 treatments with erbium laser.
Okay.
Wow.
You get it or not? Which is great. It's not aggressive. You do it like 3 treatments. You get the same result as a CO2 laser, but it's not as aggressive as the CO2 laser.
Okay.
But you need to have 3 treatments of erbium laser to get the same one result of the CO2 laser. And people love it because erbium laser has 1 week downtime and you can do it every month. While the CO2 laser is very aggressive and you need, a long downtime. You need about 1 month.
Okay, I have a question. How long is the service for a laser? And the reason I ask this, doctor, a lot of the times is because I know a lot of clients, like they're busy, like, not right now, but normal life, they're a little bit busier. And, for them, it's not always just getting the appointment, but like, okay, how long does it take to actually do? That's always a question.
What is that?
Like, how long is the appointment for a laser treatment?
Like appointment, like to come to my office?
Yeah, so is it a 30-minute
how long is the
service?
treatment?
Oh, the treatment itself.
Yeah.
The treatment itself is not that long. The treatment itself is like about max half an hour.
Oh, that's perfect.
Yeah, it's half an hour. It's just the downtime. Actually, the first time when you do it, you don't see much. You just see redness. But as time goes by, you're gonna see it's like a burn in your skin. It's like really very aggressive treatment, but it's a great treatment. So again, the treatment is amazing, but you really have to protect yourself from the sun, especially for that week. For the C2 laser, be honest with you, it has kind of a little bit of more side effects, especially hyperpigmentation, especially if you don't protect yourself from the sun. Because remember, when you do these ablative lasers, it takes all your outlier skin.
Okay.
So if you go to the sun, you're gonna get burned because it's like your baby skin did. So remember, when your skin is burned, what is gonna cause? Inflammation. Remember, inflammation is the source of hyperpigmentation. Every time your skin gets inflamed with burn or bacteria, is gonna be hyperpigmentation. That's what we call post-inflammatory hyperpigmentation. So, and CO2 is great for skin type 1, 2, and 3. Like for example, 1 is very white, 2 little bit. It's CO2 laser. I will not advise for dark skin, kind of brown skin, dark skin. I would mostly use an erbium laser. Erbium laser, it's more kind of nicer, better, not that much side effects as the CO2 laser. So that's why erbium laser came to the market, because CO2 laser was a little bit can cause hyperpigmentation for brown skin, but it's great for white skin people.
Oh, I see.
And I like that you say that, doctor, because I think some people assume that they can go to any doctor and get work done and it doesn't matter, but it does matter because you have the knowledge to understand. Look, there's different services for different skin types, not just the skin type, but the color. That's just the reality.
And that's the problem. Like when laser came out, like Asian population, they were treating them like a Caucasian. They were like giving them laser the same energy as white. Even some people, they think they are white, but they are not white. Like for example, if you go to the beach and you tan, you're not skin type 1. People that they go to the beach and they get red, those are skin type 1 because they don't have melanin in their skin.
Oh, okay.
They don't cause. Like if you go to the beach and you get red, that's skin type. If you are white, you go to the beach and you get tan, you're not skin type 1. You are either skin type 1, 2, or 3.
Okay.
If you tan, you have melanin in your skin. The time you have melanin and you get dark, the energy how you get laser is very different than somebody who's white and get red under the sun than somebody who get tan under the sun. Even you look white, but it's not. And happened with Asian population. Some of them, they were very white, and when they go getting laser, they were giving them the same energy as white skin type 1, and they get hyperpigmentation. Actually, when this laser came out to the market, there were a lot of side effects from laser, because it's very different because we have 6 skin type, 1, 2, 3, 4, and every skin type 1, the energy that you give for skin type 1 is not the same as 2, and the energy you give to 2 is not than 3. So more you go darker, more the energy go lower.
Oh, okay.
Oh, wow. Okay.
Different levels, yeah.
Yeah, more darker you go, more lower energy, and those energy really have to be very careful with it. You have to kind of flip it all the time. When you start with low energy, and you see how the lowest you can have, and you see how the skin is going to react to that energy. Then you can go up and up.
Got it.
And especially with ablative laser. So we talk about the ablative laser right now. I think it's different topics. So probably next time, I think we're probably 30 minutes too much. So next time we'll talk about different lasers, because there is radio frequency microneedling, there is a microneedling, there is all different mechanical. So mechanical is a little bit, probably we're gonna talk about another episodes for. I think
And
it's
that's
for today.
and that's totally okay, doctor, because we want people to make sure they get all this information.
That's right. I don't want to be given all the information in the same day, but we can do another episode. We talk about microneedling, radio frequency microneedling, all the type that you can use. You don't have to be ablative, especially ablative. You want to use it for somebody with really deep scars. There is some scars, but also we talk about scars. These superficial scars, you don't really need like a deep laser. You can just, there is different things. You just can cause resurfacing, skin rejuvenation without going through those deep lasers.
Awesome. Well, thank you, doctor, again, for all your information. I mean, thank you for taking the time. I know we have the time to do this right now, but it's nice that you still take the time for us and do this. Angela and I definitely appreciate it. Thank you, doctor. We will have this information up again on the YouTube channel. If you guys have questions, please leave them in the comments. We are here for you guys to get you the information you want during this time. And as soon as the books open back up, we will let you guys know so you can start getting your appointments with doctor. So.
Okay, well, thank you for, I hope all this information was good.
Oh, it's definitely helpful.
It's really very confusing. Be honest with you, even though that's what I said, I don't want to give a lot of information. I want to start with this ablative, but it's huge subjects, because people over there, they don't understand laser. They just know the machine name.
Yeah.
Like a lot of people come to me, they tell me, oh, I told them that's the machine. That's not the laser. Erbium laser has a lot of machines names, and CO2 has a lot of machines names. It's like marketing name. So, but people still don't make a difference between erbium, CO2, radio frequency. I think it's a huge subject, and it's a big subject people to understand.
Well, we're very excited to talk about that on the next episode. But I know that this is definitely helpful, and you sharing the knowledge with us is tremendous, because like we all know it, this is a very hard information to really get and to understand. So to have a professional like yourself taking the time to explain it, I think it puts a lot of people at ease that are researching and seeking this type of information. So the next episode, we'll definitely talk about the varieties of lasers, and yeah, hopefully people enjoy the information.
Yeah, variety of lasers, microneedling, these are rolling, that become very famous, rolling, the 4 needles rolling, all that stuff. So we'll talk about everything. We'll cover next time.
Well, perfect. Thank you guys, and we will see you guys later on the week, and we'll get another episode out for you guys. Thank you for listening.
Thank you.